It's endothelial cells. Now remember, if I was to ask you what a description of an endothelial cell is, it's a simple squamous epithelium. It's one layer, they're squashed, squamous, but when we put them in blood vessels, we call them endothelial cells. Now, does epithelial tissue have a blood supply? It's avascular. Okay? So remember, there has to be a way for these cells to derive their nutrients. And remember, they're not going to pull it from the blood that's right there. All epithelial tissue then has to sit on top of connective tissue called the basement membrane. That's where it gets its blood supply. So the tunica intima, the tunica interna, is a layer of endothelial cells, and then sitting deep to that is a connective tissue called the basement membrane. That's not new. So when you see it, it's essentially this structure right here. So here's my endothelial cells. This is my connective tissue. Don't worry about the subendothelial layer. It's not that important. Then we have the largest layer usually, which is the tunica media. And again, it's probably the better term, media. It's in the middle since there's 3 layers. If you read other textbooks, you might see it called the tunica muscularis, because it's the muscular layer. Since it's a muscular layer, the reason why it's the largest is because I probably have a greater amount of smooth muscle here. And you're going to see, again, as I move to the different types of blood vessels, these things change in their composition. They always have the same 3 things. Okay? Just like the lasagna. And when we go through the specific ones, I'm going to show you. I'm just kind of covering this aspect. The other thing that's present here is elastic tissue. Because this blood vessel is going to expand when there is an increased amount of blood there. I don't want it to stay that way. Because remember, when we have a thing that doesn't have, it's got a thin wall, and it generally doesn't have any muscle, it's called a sinus. So when we talk about a venous sinus, and then we're not talking about the little holes up here in the skull, a venous sinus is just this very thin, no muscle layer vessel. And we talked about the coronary sinus, which is on the posterior wall of the heart, drains into the right atrium. And then we talked about the dural sinuses, the ones that reabsorb our cerebrospinal fluid in the brain. Okay? But whenever you think of the term sinus, that's what we're referring to. So with this one, I have elastic tissue, so it has that ability to stretch. But that's not what elasticity is. Elasticity means that when it's stretched, it comes back to its original shape. Okay? And the way, because we're going to talk about elasticity in the pulmonary system as well. So the way to kind of keep that in mind is, you know, just because you've got a nice pair of shorts that you like, you can stretch them and put them on your body. But if they don't have any elastic, what's going to happen? They're going to fall back down. Okay? So elasticity is that ability to come back. And then the last one is called the tunica adventitia. And again, using the same terms that we use with the first layer, sometimes it's referred to as the tunica externa, meaning it's the outside layer. And all this really is just connective tissue. Now there's a term up there I want you to start being familiar with. When we talk about our larger blood vessels, remember I said that the heart itself, the muscle of the heart, does not derive any oxygen from the blood that's inside. It has to be served on the outside. The larger the blood vessel, that's essentially the same thing. We have a thing called the vasa vasorum. And the vasa vasorum is basically a vessel of a vessel. So there are blood vessels that go to a blood vessel to bring it oxygen, to bring it blood, because it doesn't derive it from the inside. It doesn't soak up or suck up any oxygen from the blood that's present there. So again, we've got that tunica intima, those 3 layers, the tunica media. We've got this particular one here, so there's my smooth muscle, there's my elastic, and then the outside, the tunica adventitia, the tunica externa. We have this collagen fibers, and again, you can see the little blood vessels here that would be taking blood to the area. Okay, this is an artery. This is a vein. just changes, but we still have the same general structure. And the same general structure is going to be these things here. We have endothelial cells, elastic tissue, smooth muscle, and the connective tissue on the outside. So as we go through the different blood vessels, in other words, when I go from the aorta to what's called the distributor, to the muscular arteries, and then we go to capillaries, and we come back to veins, we're going to talk about the difference here. This is the recipe that I talked about. Okay? They all have them. They just start changing the amount that they have. All right? That's what gives us that components of artery versus vein. About 60,000 miles. Again, it's more of an arbitrary number to stick in your head and it shouldn't show up on an exam. What you should notice is that we have a lot of blood vessels. Okay? For every pound of fat you put on your body, you add a mile of blood vessels. This is one of the reasons why carrying too much weight is an increase in your blood pressure, because your heart has to work harder. But not only that, if you go back to what I talked about the other day when we were talking about why the right ventricle wall is not as big as the left ventricular wall, it had to do with the system that they pumped into. And I said that one thing that contributed to an increase in resistance was the length of the vessel. Therefore, if I'm adding more blood vessels, that's adding more to the length of the vessel, so the resistance in the vascular system goes up, and that heart has to work harder, and our blood pressure goes up. Okay? Talked about this, want to make sure that everybody is familiar with this. Remember, arteries are not named for the type of blood that they carry, whether it's oxygenated or deoxygenated. They're named because they carry blood away from the heart, and veins carry blood to the heart. For the most part, 99% of the time, this is accurate. Okay? Arteries carry oxygenated blood. Two places they don't: pulmonary artery, umbilical artery. Any questions before we kind of delve into the blood vessels themselves? Okay. So we're going to start with the arteries, and we're going to move to the capillaries, and we're going to move to the veins. Now here, the largest one is going to be an elastic. These are the ones that tend to be closest to the heart. The aorta is an elastic artery. Primarily because they're going to receive a bulk of that blood. As that blood pushes against the wall, I want that elastic component to recoil. So it pushes blood in a forward direction. Because in the arterial system, we don't have valves. We don't have anything to prevent blood from going in a backward direction, except for the fact that I want that increase in that stretch and then the recoil from the elasticity that brings it back down and pushes it forward. Okay? Please do not get lost in these numbers. I am not going to ask you what exact size is considered an elastic artery. Okay? You should know they're the largest arteries. So when you look at them, here's an elastic artery here, and you can see that they all have, you're going to notice that the endothelial cells don't change. They're all exactly the same amount. It's one length of endothelial cells, regardless of what we're talking about. But what you should notice is, look at the amount of elastic tissue here as compared to those two there. That's why it's called an elastic artery. I bet you when we get to the muscular artery that they have a greater amount of muscle there. That's why it's called the muscular artery. Okay? So, again, very close to the heart. We go to the second component, which is going to be our muscular. This is sometimes referred to as distributing. These are the ones that you learn names for. Radial artery, axillary artery, subclavian artery, femoral artery, renal artery. They're distributed to their specific points, their destinations. And again, don't get lost in the numbers, but you should have an idea that this is like a tree, where the aorta is the trunk, and as I start moving out, I branch. What happens to branches on a tree? Are they the exact same size as the trunk? No, they get smaller, and they get smaller, and they get smaller. That's the take-home message here. As we start going through these different arteries, these different classifications, they're going to be getting smaller and smaller and smaller. And again, muscular, they have the highest amount of muscle that's present there. Hence the term. You should know them as distributed, by the way, as well. Now we're going to get to the arterioles. The arterioles, again, they range in a variety of different sizes. These are the ones that have the greatest impact on blood pressure, by the way. Now, anybody want to hazard a guess as to why they might have a greater impact on blood pressure when this one here has the greater amount of muscle? This has a very small amount of muscle. Why would they have a greater impact on blood pressure? Pardon me?
Size.
Not size. Not diameter. Not volume, but you're kind of close. The amount of them. These are branching and branching and branching and branching and branching. You have so many more arterioles than you have muscular arteries. So even though they have a smaller amount of muscle, there's more of them. And so they contribute to a much greater degree in our blood pressure regulation than any of the others. Now we get to our capillaries. Okay? All essentially a capillary is just endothelial cells. Now remember, they're going to have a connective tissue which is not represented here, because all epithelial tissues have to have a connective tissue for its supply. Now these can actually derive some of their blood from some of their nutrients from the blood inside, but not very much. Now again, this should make sense because these are called our exchange vessels. There shouldn't be a lot of things there. Structure equals function. This allows for the blood on the inside to have an easier access to the tissue cells that surround it. I'm going to come back and talk about capillaries in a second. I just want to show you the other picture from the venous system. So we have a venule that's going to come directly off of that. These have some very similar qualities to a capillary. These tend to be leaky. In other words, things are allowed to leak out of them. And then we go to the vein itself. And again, you can see how this changes. So the venule has really no primary muscle. We have a few little strips of smooth muscle that surround it, but you don't see a whole lot. There's no elasticity from it to speak of because there is not a lot of stretch that exists here. But when you get back up into the veins, you're going to notice it starts to have, a little bit more of that adventitia on the outside. Capillaries. 3 types of capillaries, classifications of them. And I'm going to differ just slightly with her as we go through this last description, but she still kind of talks about it. Continuous, most common. See this in the skin? It's just the most abundant of all the capillaries. What you notice about them is that it's got a fairly intact adventitia around it. Here are my endothelial cells that are present. There's just a red blood cell that's floating around through there. We have other things called intracellular clefts that are right there. They're between endothelial cells. This can get larger as we're going to look at the next ones as we start to move down. And then we have these things called pinocytic vesicles. It's another way of transporting things from the inside to the outside. A lot of things will either go through there. In other words, it's going to move from the inside of the blood vessel through the cell transcellular to the outside. The other way is they move through these little clefts right here. Okay? Now, next one is a thing called a fenestrated capillary. This is where we have to have very, very quick exchange. We're going to see this in the kidneys. We're going to see this in the lungs. In other words, if I'm going to continue with the analogy of the flight attendant, the first one is, it's the first serving of the snacks. We've got plenty of time. I'm going to walk through here, make sure your chair's in the upright position. I'm going to take all your garbage. We're going to do this nice little fun thing, and then I'm going to come back. Fenestrated means we're crashing, and I need to get the crap out of your thing, so let's move along right now. Okay? Things are going to move through much, much quicker so that we have a quicker exchange. In the kidneys, we're trying to get rid of, we're going to filter things, but in the lungs, I'm trying to get oxygen on the red blood cell as it goes by. I don't have time to screw around. So we have these things here, and this is where she's correct on this one. We put little holes in the endothelial cells. They're called fenestrations. Okay? It allows for that quicker response, that quicker exchange. I'm going to give you something, you're going to give me something, whether I'm unloading it the tissues or whether the tissue's loading it back up on the blood cell, and I'm going to take it to another part of the body. The other things we see is our intracellular clefts are getting bigger. Again, allowing for a quicker exchange. Now the last one I refer to as the sinusoidal capillaries, and it basically looks like somebody stuck a bomb in it. Okay, now this is where I disagree with her. She calls these things here fenestrations. Fenestrations are generally considered to be small, little, consistent oval shapes. This is not this is a bomb went off. Okay. So what you should also notice is the intercellular clefts are huge. This is what we see in the spleen. So with the sinusoids, with sinusoidal capillaries, potato, this allows for the macrophages to put their processes in when these red blood cells get all kind of old and their cytoskeleton doesn't move around and I get stuck. Remember, the spleen is what? It's the graveyard for red blood cells. Okay? So then it allows for the destruction of that process. So spleen, to a certain degree the liver, but that's primarily where those are found. And again, as you read through here, she's going to call those fenestrations for the sinusoids. I don't call them fenestrations. If I was to ask a question on which one are fenestrated, this is the correct answer, because they're the ones with fenestrations, not this. And she's probably one of the only anatomists that actually calls them that. So I don't know why she's kind of hung up on it. But. Any questions so far? So I'm going to continue with the capillaries for just a second. Because we have a modification. You go back to this first picture here. So capillaries, this one or this one, they have, this is referred to as a capillary bed. Okay? Capillary network is another term, but capillary bed is one that's used more clinically. And so each one of these is a capillary, but when they come together, they form this network or this bed. All right? Now, when we look at them, okay, this is referred to as our microcirculation. Why? It's the smallest vessels you got. It's the ones that are actually delivering stuff to your tissues. Now, I've got a terminal arteriole right here. What all terminal arteriole means is that I'm going to have branching from it. So we have arteries, arterioles, we have capillaries, we have venules, and then we have veins. So this process here is a terminal arteriole, and then I'm going to have what's referred to as a met arteriole that comes off of it. This is a met arteriole right here. Okay? Now the met arteriole is going to, if it was just to continue, we're going to change its name as it moves towards the venous system. So here's my venule over here. So as this met arteriole, and again, you might not see it just yet, but as I keep going through, it's just one big road that goes from one side to the other. On this side, it's referred to as a thoroughfare channel. Together, they're referred to as a shunt or a vascular shunt. The reason why is because if you shunt, it means I bypass something. So, on this whole process, one of the things that you should notice is on the arterial side of the capillary bed, we have smooth muscle. It's right there. And they're called sphincters. They're precapillary sphincters, but they're just sphincters. Anytime you hear the word sphincter, we're going to talk about a couple different ones. We get into the GI tract and the urinary tract. But for the most part, sphincters are made up of smooth muscle, which is involuntary. We have no control over them. And it ensures one-way movement. So anytime you hear the word sphincter, it has to do with basically stopping movement of something so that things are just, it's a one-way shot. When these contract, then I shunt my blood. If you notice, the blood is not going out to these capillaries. It's going directly across over here to the postcapillary vein. That's a shunt. We would do this for if you were cold and we were regulating body temperature. So when you go to a Duck game on a cold Saturday morning and you happen to look down at your hands because it's 32 degrees outside and you didn't bring your little mittens, they're going to be white, possibly even blue. It's not because you don't have enough oxygen, it's because we're shunting the blood. They've closed these things down. I don't need to send blood there because I'm going to lose heat. Okay? We do it with our digestive system. I can shunt the blood from my digestive system by increasing my sympathetic nervous system. That's why you have the old myth that you shouldn't go swimming for an hour after you eat. I was going to say it the other way around, but which is a myth. Because your sympathetic will always trump your parasympathetic. But what's going to happen is you might end up with diarrhea. Because you're going to be shunting the blood away from the stomach, digesting the food, and sending it to your skeletal muscles. Okay? So there's a variety, and at the end of this chapter, we'll talk about exactly how this is regulated. Okay? So this, again, to use the analogy of the flight attendant, this might be everybody gets peanuts. Here, first class gets peanuts. Nobody else. Okay? So there might be a rationale why I don't take nutrients to a certain part of the body. I'm going to regulate. Okay? When we get into the physiology, the one analogy I want you to think of is your house. Okay? You have a water main outside your house that's going to bring water pressure so the water actually comes into your house. That's your blood pressure. And we're going to talk about how to regulate that blood pressure. But then after we learn how to regulate the blood pressure, we're going to talk about, hey, how do I turn on the dishwasher? How do I turn on the washing machine? How do I turn on the shower upstairs? That's the tissues. These are not on. Your washing machine, unless you have 12,000 children, it's probably not going all the time. You regulate. Your dishwasher's not going all the time. Okay? So this stuff, your tissues, is going to get regulated by a need. But to be able to have water come inside your house to run your dishwasher, I have to have water pressure outside. That's your blood pressure. And that's how we're going to divvy up the physiology when we get there. Now, to finish this off, we have, continuing with our venous system, we've got our venules. Again, these are very similar. They have a little extra stuff on them, but they're still somewhat leaky. In other words, things can leak out of them and go to the tissues. Not as much as a capillary, but much more than any other vessel. And again, we're starting on a different process. In the arterial system, what you should have noticed was, as I move from arteries to, so if I went from an elastic artery to muscular artery to an arterial to a capillary, you should have noticed that they got smaller, so that's the tree. Because remember, that's what the arterial system does. It diverges. The venous system converges. So all those small things are going to be coming back to bigger and bigger and bigger things. So our veins are going to get larger the closer they get back to the heart. That's the reason why the superior vena cava and the inferior vena cava are the largest of the veins. So when we talk about veins, okay, their lumen, in other words, the opening inside the blood vessel is larger than an artery. Their walls tend to be somewhat fairly thick, mainly because of the amount of collagen that's present there. But even though it's a thick wall, it still tends to be a thinner overall from the inside to the outside because the diameter is bigger. So it's the thickest wall, or the thickest layer in a vein is the outside one. Now, this is a low pressure system, so if you cut yourself, this is one of the reasons why you're able sometimes to see if you're taking care of a patient who's in trauma or somebody who just had an injury and you're looking at their bleeding. If it's spurting, it's arterial, because arterial tends to be much higher pressure. If it's just leaking, it tends to be a venous blood. Now, these are our high capacitance vessels. Now, just a fancy way of saying it's a reservoir. What do I mean by reservoir? This picture right here. 2/3 of your blood is in your venous system at any given time. not just sitting there, remember, but it just is able to hold that much blood because it has a bigger lumen. Now you should probably have a pretty good idea that basically we have about 15% each of the blood is in the arteries and the capillaries, and then the rest of it remains in the heart, not capillaries, in the pulmonary capillaries, and then the capillaries in the heart over here. So again, the number I care that you know on this particular diagram is that 2/3 of your blood is in your venous system at any given time. And then basically if you just think of the rest of it being divisions of, even though the numbers don't add up completely, 15, 15, and 15, you could basically say that 15's in the arteries, 15's in the pulmonary system, the heart and the capillaries make up the other 15. Again, they're not going to add up to a complete 100, but it gives you a rough idea about where things are. This is also one of the reasons that sometimes when people, if you've ever had the unfortunate experience of taking care of somebody who's attempted to kill themselves, specifically with slitting their wrists and so forth, the arterial side is not really the ones you want to do because they will actually vasospasm off because they have a higher musculature. So the venous system, and if you go in vertical lines, I'm not telling you how to kill yourself, but vertical lines tend to cause more damage and more blood loss. Even though it's seeping, you're cutting more vessels because of the direction of it and so forth. Now, as I'm standing up here, blood has to go where? Back to my heart. So the blood down here and the blood in my arms are going to have a harder time because of what? What's a force that's pushing on them, or they're working against? Gravity. Got all the stuff that's pushing down, so it's got to make its way up the hill. So we have some modifications of endothelial cells. These are just like, they're a poorer version of the valves in our heart, okay? And what they do is they allow for blood to move up. So once they get past these valves, it's just like the semilunar valves. Blood can't come backwards. If they can't come backwards, then I don't have retrograde flow. So we see valves mostly in our lower limbs and to a certain degree in the arms. We don't see a lot of valves in some of the larger veins that's present there. And we'll talk about how this actually works, but this is one of the reasons why it's always important to get up and move around, is that as I walk around, the muscles in my legs squeeze down on the blood vessels, the veins, which is shoving blood up past the valves. You can kind of find them sometimes if you just let your arm hang down, and it basically causes an engorgement. And then what you can do is, when you find a vein, is go ahead and block off the distal end and slide your finger up the vein. And that vein should disappear as long as I'm holding it down here. Because what I did was I took the blood in this little range and I pushed it past the valve. So it can't come back. And since I'm pushing here, it can't fill up. So it gives you an idea about where the different valves are. Those of you who've ever either started an IV or been around people that start an IV, occasionally these get in the way when you're putting them through. So you'll see people say, could you go ahead and flush that? And what they do is they flush it and it pushes past the valve. So they're able to advance the catheter. Sometimes if you get a catheter that's right there, it doesn't want to go through. So different ways of working on it. Now these things can become what's referred to as incompetent. Remember that when we talked about incompetent veins in the heart, we talked about our tricuspid valve, we talked about our mitral valve. Both semilunar valves could also potentially become incompetent. Here, the valves no longer work. And that's when you see varicose veins. Varicose veins look like this torturous mountain road that takes all these little twists and turns and twists and turns and twists and turns. For the most part, they're not painful. Some people do experience some pain with their varicose veins. They're just mostly unsightly. And you can have little tiny ones called spider veins, and on tomorrow I'll show you a couple videos of the process of how you can get rid of spider veins with sclerosing chemicals. It basically just hardens them up and they just disappear like that. It's kind of impressive to watch. But these you'll see, so people that are pregnant are at a higher risk for varicose veins because you've got that baby inside that's pushing down and it's a resistance of blood coming back. Therefore, it's constantly keeping it on the pressure on the lower legs, and therefore you stretch those veins out. People that tend to carry an extra amount of fat on their body, people that stand all day long, because it's one of those ones where you're just kind of there and it makes it harder for the blood to come back up. Any questions on that? I'll show you some videos on that tomorrow. We'll start into the physiology component tomorrow and go from there. Again, you still have that blood vessel question. I think I've only had 2 people that have asked me for examples. Since you're certainly not required to ask me for an example, but when you don't do well on it, it's probably going to be my